Let's quickly talk about the tonsillectomy medical surgery, which is done to remove your tonsils if your tonsils become inflamed. Okay, so talking about the tonsillectomy surgery, and or you could say that it's a surgical procedure, right? We'll talk about the definition. We'll talk about the indications. That's like times which you should do this type of surgery. Then we'll look at the types of tonsillectomy surgeries that could be done. We'll look at the post-operative care, then the risks and complications. All right. So for the definition, we said that tonsillectomy is actually a surgical procedure to remove the tonsils. The tonsils are this, okay, at the sides of your mouth. So if the tonsils become inflamed, then you, after looking at the indications, then you might just want to remove them. Okay. So these tonsils are masses of lymphoid tissues located on either side of the back of the throat. The procedure is usually performed under general anesthesia and takes about 30 to 60 minutes. Indications for tonsillectomy, that's when you should do it. What conditions will necessitate it? Okay, so if the person has a recurrent tonsillitis, that's inflammation of the tonsils, for more than 7 episodes, more than a year, you just have to remove it. If it's a chronic tonsillitis, that's what? There's a steady tonsillitis for a very long time. If the person is having sleep disorders like sleep apnea and snoring, the person is having difficulties in swallowing, the person is having tonsillar abscess and peritonsillar abscess, the person has cancer or suspected cancer of the tonsils, then the person has what severe halitosis, that's a bad breath, okay, which is very severe. You just need to take out the tonsils. Then types of tonsillectomy surgeries that could be done, there could be traditional or cold tonsillectomy. This one is surgical removal of the tonsils using a scalpel or forceps. Well, no picture, yeah. See, scalpel or forceps. This one is traditional one. Then we have the laser tonsillectomy, just using a laser to remove the tonsils. We have radio frequency tonsillectomy. This one uses what? Radio frequency to remove the tonsils. Then we have what? Intracapsular tonsillectomy. This one removes the tonsils while leaving the tonsillar capsule intact. Then after you've done tonsillectomy surgery for a patient, care that follows it is the post-operative care. You might want to opt in for rest, hydration, pain management with medication. Then the person should be eating soft food for a period of 1 to 2 weeks. Then the person should also avoid any strenuous activity. Then follow-up appointment with the surgeon is necessary, okay, so that they can be checking you and see how you are improving. Then talking about the risks and complications, this surgery could lead to things like what? Bleeding, could lead to infections, could lead to respiratory complications, could lead to swallowing difficulties because you have a wound right there where food is supposed to pass. Okay, so swallowing difficulties can also lead to scarring. So that's what tonsillectomy surgery, which is a surgical procedure to remove the tonsils. Okay, indications, types, risks, and complications.